Good morning, everybody, and thank you very much for joining us on what sadly is the last day of ESOC 2022, and it's been a great meeting. My name's Jess Dawson from the University of Glasgow, and I'm delighted to be joined this morning by my co-host, who is Dr. Aristides Katsanos, who has joined us all the way from North America, although he is a European at heart. So welcome and thanks for being here. And I also have two very special guests this morning, who I'm sure many of you will know. And I have Professor Guillaume Turc, who's from Paris here in France, and Professor Simona Sacco, who's from the University of Lechia in Italy. And before we start, just to highlight that our guests today do a huge amount of work as part of the guideline committee, and we're really very grateful for all of your work in helping drive the standards of stroke care throughout Europe, and we'll hear a little bit more about that in a second. But I think it's quite nice on the final day just to reflect on some of the highlights, and I think there have been some really high quality scientific talks. So over to you, Aris.
Yeah, what a meeting, like amazing vibes, great science. The first day really took off with clinical trials, covered the whole spectrum of stroke, right? So we discussed about pre-hospital triaging, then reperfusion treatments to necroplase, basilar artery thrombectomy, and of course some procedural stuff, general anesthesia, conscious sedation, and also tracheostomy, and of course secondary prevention, how we can communicate better with the patients, and also antithrombotics, right? So the second day was equally strong, a trial for patients with ICH, and what I can say, like a snapshot of the future of stroke with stroke genetics, epigenetics, and also the role of inflammation in stroke care. So I think we need some time to digest all this information and go back to our institutions and think if we're going to change our practice eventually over the next couple of months. And that brings Simona to my question. Can you take us a little bit behind the scenes and tell us how ESOC guidelines are done?
Yes, thanks, Aris, for this question. It's a process that was developed across years, and not all guidelines are the same. And ESO aimed to have strong, powerful, and trustworthy guidelines. And for this reason, the society decided to adopt a strong methodology, which is the GRADE methodology, as the methodology of choice to have its guideline done. And the first step when you are doing guidelines according to this methodology is to draft a very clear clinical question, and this is called PICO questions. And in this PICO question, there's a definition of the population and the intervention you are interested in, but there's also the definition of the comparator and of the outcome, which is very important to properly address all the study. The second phase is the systematic search of the literature to identify all the studies which provide information relevant to the topic you are addressing. And then this is followed by a quantitative analysis with a meta-analysis of all the studies to pull together their results and have an estimate of the overall effect. There's one additional step, which is the rating of the quality of evidence. This is done in a very rigorous way, follow very precise rule. And after addressing the quality of evidence, you can arrive to judge the quality of evidence as low, moderate, and or high. And then, after addressing the quality of evidence and having an overall estimate of the effect, the group prepares the final recommendation. And the final recommendation can be weak or strong, for or against a given intervention. And the final recommendation is also drafted following some rules to have a clear message to the users. In some cases, you do not find enough quality of evidence to make an evidence-based recommendation. And in this case, to provide anyway a guidance useful for clinicians, ESO decided to provide expert consensus statements, which are very useful from a clinical point of view. All this process relies on the expertise of the working group and on the support of a methodology who has expertise with the great methodology and who is hired, who works for the ESO. There's a well-defined standard operating procedure, which is published. And so after this long process, which takes really several months, we arrive to having the final guideline. And the final guideline is usually presented during ESO conference. And we will have a session, a very important session today. And it is simultaneously published in our journal, which is the European ESOC journal.
Thank you so much. Thank you for giving us the recipe for the successful ESO guidelines. That's great. Thank you, Simona.
Thank you. And I think having been involved in one of the guidelines, I think all of the guidance that we get from the committee with the frameworks and how to go through the methodology is hugely, hugely helpful. So there's a big structure behind this, isn't there? And I know that the guidelines have been a real priority, Guillaume, for ESO and accelerating the amount of guidelines, not just how quickly they're done, but the volume of guidelines. So there's now a big library of guidelines really available. Tell us a bit about the guidelines that already exist and some of the recent ones.
Thank you, Jesse. So actually, we have many guidelines that have been published over the last year and also many guidelines in the pipeline. Mm-hmm. And so I had actually to write them down because I could not remember all of them. So in 2021, 10 ESO guidelines were published on intravenous thrombolysis, covering many subtopics and subgroup of patients. TIA management, mm-hmm. including imaging and pharmacological management, and also the usefulness of clinical scores. Also a joint ESO-EAN guideline on post-stroke cognitive impairment, mm-hmm. Covering many aspects of this condition. A guideline on space-occupying brain infarction, blood pressure management in acute ischemic stroke and intracerebral hemorrhage. Intracranial and extracranial dissection with therapeutic and also diagnostic aspects. Post-stroke dysphagia and swallowing disorders. Covered small vessel disease, endarterectomy and stenting for carotid artery stenosis, and also an expedited recommendation, which is a new form type of guidelines that really aims to rapidly address a very hot topic in which there have been some guideline changing studies recently published. And this very first expedited recommendation was on short-term dual antiplatelet therapy for acute minor stroke and also high-risk TIA.
So that's 10 in 1 year. I hadn't realised it was quite as many as that, and really does cover the breadth. And I think that one of the guidelines that I quite enjoyed reading was the covert SVD one because I have a bit of an interest in it. But secondly, I think as well as telling us what we should do, the guidelines often tell us what we don't know, and have very, clearly summarise our evidence gaps and what we need to fill, as researchers and academics. So what's coming next then? Do you have a list of guidelines that are in preparation?
Absolutely, and this list is actually quite ambitious as well. So fortunately, we have 3 guidelines which have been already published, and 2 of them are really on very hot topics with recently published or communicated evidence. The first one is on mobile stroke unit. Okay. And I think this is certainly the very first guideline on mobile stroke unit in the world. And the second one is an expedited recommendation, which is a joint document by ESO and ESMINT on the very hot topic of direct mechanical thrombectomy versus bridging thrombolysis before thrombectomy in patients with acute ischemic stroke. And the third one is also very important topic on stroke in women. So these are the published guidelines, and they are available on the ESO website and the ESO guideline directory for free. And today we are very lucky to have 4 important guidelines which will be presented at the guideline session at 10:30 in the amphitheater. And the topics are unruptured intracranial aneurysm, screening for atrial fibrillation in patients with cryptogenic stroke, intracranial atherosclerosis, and very much anticipated guideline on secondary prevention and pharmacological approach, and that you led with Alistair Webb.
Yeah, with Alistair, yeah, indeed. No, it was good fun. So that's 7 guidelines already this year, which is tremendous. No, really good.
Do you need more for 2020?
Why not? Why not? Yeah. What is so those 4 will be published very shortly and presented today, and then there's more planned for this year.
Absolutely. Yeah. So actually we plan to have a guideline webinar certainly during autumn.
Okay.
And we plan to have also some guidelines published by the end of the year, or maybe the very beginning of the next year. And these topics include patent or persistent foramen ovale, an update of the guideline on intracerebral hemorrhage, a guideline on primary angiitis of the central nervous system.
Yeah.
Another guideline document on moya and post-stroke pneumonia. And we are also starting an ambitious series of guidelines on post-stroke rehabilitation, which I think will be very needed for patients and caregivers.
So there's a mix there of some really very specific topics, which is nice, some individual diseases almost that for which I think guidelines are very helpful, because we don't see these cases very often, but when we do, we really need some help and support and guidance to know how to manage the patient. So thank you, a lot of work, and well done, Aris.
Yeah, sounds like the best is yet to come, right? So is it the same for the plenary session this afternoon, Simona? Does it worth following the session instead of going to beautiful Lyon? What are we going to see?
Yes, I suggest to follow this plenary session. There will be the closing ceremony and also the presentation of some other very important large clinical trials. And I wanted to raise your attention just on some of them. There will be the Actimis study, presentation of a novel antithrombotic drug. There will be the Texais study on the treatment of hyperglycemia in acute stroke. Also, some subgroup analysis from the Enchanted study will be presented. The topic is lowering blood pressure in acute ischemic stroke. Then there will be very interesting the TWIST study with the tenecteplase in wake-up stroke. And there will be some few presentation about novel oral anticoagulants in ischemic stroke. So really a session not to miss.
I'm convinced I'm going to stay. How about you, Jeff? Are you going to stay? Or?
Absolutely. Yeah. No, I would encourage everybody to watch it. And if people do need to, to catch flights, we remember that everything will be available, in a very short period of time to watch on demand, so we can catch up on things. And Guillaume, anything that's caught your eye for today?
Actually, several things, but I do have some good news and some bad news.
Okay.
So the good news is that there are many very interesting sessions, and the bad news is that unfortunately some of the sessions are scheduled at the same time.
Sure.
But the good thing is that because this is a hybrid conference, and you will be able to watch all the different sessions and even rewatch them in case you need. So actually, I think that there will be some very exciting sessions. One on genetics and epigenetics of stroke, which will be at 8:30 in the Auditorium Lumière.
Okay.
And also we will have several presentation and sessions on precision medicine and individualized patient care, notably for new perspectives of etiological classifications of ischemic stroke, which I think is something that really is useful for many clinicians, and also for individualized stroke care. And these sessions will be at 8:30 and at 10:30 respectively. And then we will also have a joint ESO Presto session that will start at 8:30 in the amphitheater. And Presto is the pre-hospital stroke treatment organization. And this was founded in 2017 with a special interest in mobile stroke units, which is obviously a very hot topic. So in this session we will have talks on efficacy, but also on economic analysis, because this is a very important aspect, because these are very expensive ambulances. And we will also have talks about LVO detection, but also on new technological approaches for pre-hospital stroke care.
Oh, nice. So, and if there's anybody watching that wants to buy a mobile stroke unit, is there a shop in the exhibition? Is there a place where we can go and take one home with us?
I think that would be great.
It would,
maybe in the next conference.
Yeah, okay, that's the target
for held in Munich.
In Munich, absolutely. So that's the target for 2023. No, thank you very much. So there's a really good mix there of some things for the future, but also some practical sessions about what we should be doing today for people with stroke, which is great. So thank you.
So I don't know if you can buy a stroke unit, but you can definitely grab a coffee and come with us. So thank you very much, Simona. Thank you very much, Guillaume. And of course, thank you so much, Jesse. And looking forward also to see you, and thank you for following us. So grab your coffee and we'll see you all in the meeting rooms. Have a great day.
Thank you.